So welcome to the 11th episode of the Surrogate podcast. I am thrilled to welcome to the studio today two sets of parents who are not just set of parents, but are the IPs that I'm working with on my surrogacy journey. So Daniel and Eduardo, and also Catherine Stagg, who is a lactation consultant. And today on this episode, we're going to be discussing everything to do with feeding and feeding choices and everything around lactation. So I'm keen to get stuck into this. I've got questions of my own to be asking. So I want to welcome you all to the studio. And Catherine, tell us a bit more about you.
Okay, well, so I am Catherine. I'm a mum of 4 boys. I had twins 20 years ago, which was a bit of a baptism of fire, and then completely crazily had 2 more children afterwards as well. They were boys and a very chaotic household. So I had really good breastfeeding support, managed to breastfeed my twins. And because of that, I got given the chance to train as a peer supporter, which, you know, a sort of well-informed mum is what we basically describe ourselves when we're peer supporters. Started volunteering locally. I come from Harrow in northwest London, so did lots of the breastfeeding groups. Did that for a good 11 years, completely fell in love with it, and decided to increase my training. So I then trained as a breastfeeding counsellor about 5 or 6 years later, and then worked for the NHS for a year. And then basically, because the NHS doesn't have much money, they said they couldn't afford us again. That's what. Then you didn't work for the NHS, didn't you? This again after that, and that was the point where I thought, okay, I either go back to teaching like full time, or I do my lactation consultant. So that was the thing I did. So yeah, I studied hard for that. Thankfully passed. So I've been a lactation consultant for 8 years now. I generally work in private practice, but also run a charity for supporting breastfeeding twin and triplet parents.
Amazing. I can't wait to learn more about your work. Edu, tell us a little bit about you.
Yes, my name is Ordo Camarena. I am an architect. I've been in the UK for 10 years. I arrived here with my partner Daniel, who is next to me right now. And we essentially decided, we always wanted to be parents, and we got in contact with my surrogacy journey in mid-2023, and we met Kay, and things, I guess, escalated. we can say, and we were very thrilled to be here and take part of this podcast.
Great to be here with you. And you, Daniel?
And me, my name is Daniel Gonzalez. I'm Edu's partner, and I'm also on a journey with Kay. I'm a video games designer. And I think you covered pretty much everything. We live in London. We've been living there for more than 10 years. And we are now awaiting a baby girl that is going to be born in less than 2 months, 1 month and something, which is crazy.
Yeah, that sort of nervous look that we've all possibly got over our faces at the moment. It's like, we're there, we've done it, we're there, like final leg of the journey. Yeah. So let's really delve into feeding. I'll give a bit of my own context to this, I suppose. I've got 2 children who I had before doing surrogacy journey as well, both breastfed. I'm a doula. I'm a huge advocate for breast milk and breast or test feeding where it is possible in journeys where the child belongs to the carrier. And I am also, within this journey, I have offered to do expressing because of that belief around the value of breastfeeding for Danny and Edu's daughter for the first 3-4 months as that kind of progresses. And there's also loads and loads and loads of surrogates and IPs and people giving birth who go on different journeys. So Catherine, talk to us a little bit about how your experience feeds into supporting other people.
So basically, if we are supporting surrogate parents, if they have working breasts, i.e. they are born female, or sometimes actually trans women can also lactate well if they've had hormone treatment and they have working breast tissue basically. So if we've got any working breast tissue, as a surrogate parent, you may find that you can induce lactation. So that's one option that we can investigate. Other options are, of course, that the birth parent pumping, expressing for the baby as well. So that's the kind of main 2 things that I think will probably be discussing today, really, isn't it?
Yeah. Do you also support people who choose to exclusively formula feed, or is that separate? Yeah.
And a lot of we can actually improve things like bottle feeding technique in particular quite a lot, and there's a lot of problems with support for parents generally around feeding. And as a lactation consultant, I don't just do lactation, even though that's in my job title. And the majority of people that I support, birthing parents generally, most of them are not exclusively breastfeeding because well, they wouldn't need a lactation consultant. So, so we try and kind of optimize their journey, optimize what they are looking at, trying to work out what their particular goals are, trying to get as near to them as we possibly can. But also sometimes having to make informed choices about, which way we can go, whether we can introduce some formula if we need to. And sometimes introducing formula actually means that they will breastfeed for longer. It does sometimes happen that way. So, it's just every option, basically. So
all the options on the table and working it out with people. And I suppose for our listeners, it's such an interesting thing, isn't it, that probably doesn't come into thinking when you're beginning to think about surrogacy, but actually feeding is such an important part of that journey. Danny and Edu, pre us starting this journey together, be really honest with me, I've never asked you this question. Had you ever thought about how you were going to feed your baby before starting a surrogacy journey?
Yeah, I think we always had in mind that we were going to be using formula all the way through. I think for us, our approach was and always been putting our surrogates' body autonomy first. And I think because of that, we always thought that, let's think that formula is on the table, let's just go for formula. And then we can have a conversation with our surrogate, and only if they feel comfortable about, expressing and collecting milk, breast milk, then we will go with that. And it happened that, we had that conversation and you were happy and comfortable to express and collect milk. So, and we see the benefit, obviously, in breast milk and, how beneficial it is for babies. So we said yes to that.
Is it in your family context? Do you know if you two were breastfed?
Yes, I think we did.
Yeah, you both were.
I think in Spain it's like very default option, but I think I can see how that is changing because, for instance, among my social group, I know many people who went for formula all along because of different issues, sometimes it was health, sometimes it was a preference, but yes, I think culturally is very much embedded into traditional in Spanish culture, I would say.
Okay, that's interesting to know. So I'm going to reel back to something that you mentioned when you were giving your wonderful intro, Catherine, which is the idea of inducing lactation. So let's say that we're working in a surrogacy journey where there is somebody who's got breast tissue that they can work with. Talk to us about what that looks like and inducing lactation.
Yeah, so it's something that a lot of people don't actually realise is possible. I was actually on the phone to my mum when I was here, and she's obviously followed my journey massively into breastfeeding sport and such like. And I said, yeah, I'm here to do a podcast and we're going to talk about inducing lactation. And she went, what's that? And I explained, and I was like, oh, I didn't know that was possible. So yeah, so actually as a non-birthing parent, if you have if you have breast tissue, in theory, we should be able to get some lactation going.
Yeah.
And for some people, it's really important for them to actually do this, and it helps them feel maybe that they're quite connected to their baby, and also giving them all the nutrient benefits and the immunity is probably the main thing actually with human milk is the immunological factors. Really, I think that's the main thing that you really can't get from formula.
Yeah.
Microbiome, all that kind of stuff. It all helps with that. So yeah, so it is possible. We've had in our society, especially in the UK, we're not really a breastfeeding society yet. It's starting to turn back around again a little bit, thankfully, over the last few years. But we've had really 2 or 3 generations of a lot of formula feeding, and
a lot of need for people like you to get breastfeed back on the table. Yeah.
And it's just cultural now that everyone, it's now not the default way of feeding your baby in a lot of areas of the UK. And we're now starting to turn this back around again, which is great. But yes, so it is actually absolutely possible to get some milk production. Now, it's sometimes a little tricky to get a full milk production. So maybe, for your baby's entire needs. But actually, a lot of research into lactation, especially around the immunological factors, is actually even a small volume each day has massive health benefits for your babies. One of the studies it's often cited, is mentioned on a website called Kelly Mom, in that they think that even sort of 50 milliliters a day probably has quite a big effect on the health of the baby. So that's barely anything really, you know what I mean? So it's, it really is a lovely thing to be able to do if you're feeling that you're able to.
Yeah, and I know that's something that we've spoken about a little bit on our journey, is particularly the immunity factors of it. There's a thing in breastfeeding which we'll probably talk about a little bit more, which is called colostrum harvesting. So we'll talk about that specifically in a moment. But I began colostrum harvesting the other day, and I think I felt more proud in that moment to get a little 2 ml syringe because of the immunity that I know that this is providing for Danny and Edu's daughter. And it's my children, when they were breastfed, I was just astounded at what my body was able to suddenly pick up and heal. And Danny and Edu, how important is that to you? Knowing that your daughter's going to have access to something that builds her immunity.
Yeah, very important. Sorry.
If you'd said not important, we would have been like, get out the studio. That's actually don't care.
No, again, like as I said before, we are very aware of the benefits of breast milk, and that was obviously something that we always had in mind, that if our surrogate was comfortable with that, that would be the ideal scenario. And it just happened that, that's exactly what we're doing. But yeah, we are very happy that that's happening. And
and we are just going to take it in a very relaxed way, like I think for us, let's say formula always was the default option because of our circumstances. Yeah. You offered to express milk. We felt totally blessed. But of course, let's see how it goes, So as Catherine was saying, probably we will end up doing some sort of mix between both, depending particularly the first days, how much milk is being expressed, etc., So, but of course, and it's very good to hear that even a small amount can be so beneficial for immunity. So it's really a blessing. I'm going to really dig into that now in relation to our specific journey. So I've always understood the relationship between gestational carrier mum and whoever the feeding person is in a breastfeeding capacity to be a very much sort of relationship between what the child feeding from the breast is then giving off signals to the milk. Talk to me about how that works if you are exclusively expressing way.
So what we have to do if we are trying to establish a supply without the baby feeding directly is that we have to try and make it as close to that as we can via expressing. So what we tend to do in the first few days, so we have colostrum to begin with. So colostrum is the first milk. It starts in the sort of second trimester of pregnancy. Whilst you're pregnant, we have all our pregnancy hormones keeping a lid on production. Your body doesn't need to be doing extra at the moment. It's growing a human already. But the breasts are kind of practicing in the background. So the pregnancy hormone just keeps a lid on that, and your body just reabsorbs any colostrum that it makes to start with. So we can begin to express in the later weeks of pregnancy. You can start to get a little bit of a head start, which is quite a nice thing to do, and probably a good idea in this scenario as well. We're trying to get your breasts working as effectively as possible. Once the baby is born, what we normally suggest is to try and hand express within 2 hours or so of birth. Usually, most hospitals have a protocol of within 6 hours if it's somebody birthing their own baby. Maybe babies had to go to the neonatal unit or something along those lines. But personally, I would say if you can do it earlier, it's always better to do it earlier if we can. And then once the baby's here, what we're trying to do is to stimulate the breast to as if they were being fed from. Now, anybody who's had a baby, babies feed a lot. A lot. All the time. So we're trying to also mimic that as well with expressing. So hand expressing is really good for colostrum, and it's very, very small quantities. It's very, very thick and sticky. It's very concentrated. It's sort of runny honey.
It's like human honey, isn't it?
Exactly. Yeah, human honey. And if we try and pump that, it just kind of gets lost in all the pump parts. You can use the pump for stimulation. So you can use a pump alongside hand expressing, but we tend to hand express to collect it. So a lot of people use a pump on massage setting and then hand express to actually collect the colostrum. So we can either sort of take it straight off the nipple with a syringe, it literally drops. So you can sometimes see a drop and you can suck it straight up. or sometimes it starts to kind of ooze down the breast a little bit. And so, you're like, oh, I'm wasting it. So you can just put a little cup underneath and sort of scrape it into the bottom of the cup and it sits there. We usually store colostrum in syringes, small quantities.
It's particularly fun when your 12-year-old son walks in and you're sat there with a spoon and a little syringe like I was earlier this week. And I just, Mummy's doing strange things. Come back later. And he was like, whatever.
So but yeah, we tend to store it in syringes. You can feed it directly to the baby from a syringe as well, so it works really well storing in syringes. And then within sort of it's usually 2 to 3 days after birth. So it's the birth of the placenta that triggers what we call lactogenesis 2, which is your milk coming in, as sort of describes more in layman's terms, so to speak. And that's basically because once you birth the placenta, your progesterone, the pregnancy hormone, drops, and that allows your prolactin, which is the milk-making hormone, to rise quickly, and your milk starts to come in. And that just basically means that more water is added, and also the balance of nutrients changes slightly as well, more lactose in it and such like too. But it's basically the same stuff. So colostrum is like, the sort of diluting juice without the water in it, and then the human milk is like when you've got a larger glass.
It's such a good explanation of it all. So that's really helpful. Have you guys got any questions about that part of it, Catherine? You don't have to have just no.
Never saw it as how do you describe it? Human honey?
Human honey. It is really sticky.
Yeah.
It's magical stuff. So, obviously, not everybody is going to choose feeding. So let's just stay at this point that we're at the moment of like immediately after birth, colostrum coming in, what have you. What about for gestational carriers, surrogates who decide, actually, this isn't for me, this isn't what I'm going to be doing. What do they do then at that point?
Yeah, it's tricky. If you're not going to be expressing for the baby, your milk is going to come in anyway.
Yeah.
Because it's just part of the birth process. And it can be quite uncomfortable and, painful if you're not wanting to express kind of thing. So actually what we would probably do is maybe do a little bit of expressing for comfort, just to relieve the pressure in the breast and stop you, becoming unwell. We don't want things like mastitis happening and such like that. So some, it causes inflammation. So we use sort of cold compresses, and maybe just relieving the pressure. So you can do a little bit of pumping just for comfort. So we don't want to be pumping for long, periods. So maybe 5 minutes or something like that, just to soften the area. If we are pumping a kind of full feed, that's going to then continue your lactation. So you have to kind of be a bit careful not to do too much pumping, but we also need to make sure that the parent is comfortable as well and not feeling too sore. So there is medications that you can ask to be given as well, which will sort of speed up the process of dry
ceasing. Yeah. Okay.
So that's something that you can discuss with doctors who can prescribe, so to speak, as well. So that's something that's worth looking at if you're not going to express the milk.
Are there benefits to a carrier expressing? I mean, I would, if I were supporting a family who were choosing to breastfeed and the baby was theirs, they weren't on a surrogacy journey, I would talk about the benefits to the mum as well. What's the case in surrogacy? Are there benefits?
Some benefits. So one of the main things for the parent, or the birthing parent, is there's maternal health has, like reduced risk for breast cancer, some other cancers.
Okay. And that's the same with expressing?
Absolutely. Yeah.
Okay. Amazing.
No.
Danny and Edu, let's talk about all the kit and caboodle and the stuff that goes with feeding a little bit, because our plan is that we'll be together for the first few days after birth, and that I'll be expressing and obviously be able to just hand that to you. Mm-hmm. But then you go back to London and I live in Devon. So navigating that, what have you had to begin to think about buying? What kit have you had to get in place for feeding baby?
Yeah, we already have, I think, everything needed. We already bought a formula, different brands as well, just in case, the baby doesn't like one, so we can try the other one. Loads of bottles of different sizes. I think we have basically everything that you can buy.
every time a bottle that there is.
Yes, also get the baby doesn't like this bottle, so we can try this other bottle. But yeah, the idea is to, again, we will try, it's going to be probably a combination of formula and also breast milk. We don't know how much breast milk we're going to have. And again, that's totally up to you. And yeah, whenever we have breast milk, we will use that. And whenever we don't have that, we will just go back to formula. And yeah, I think that's it.
I found interesting this thing that, Kathy, that you mentioned about bottle feeding techniques. What is that?
Because we are going to need those.
Because
you know those techniques.
Because I know that
Quickly give them all to us now.
I don't know. No, this might not be necessarily the context, but I know obviously we've been doing some reading in preparation for becoming parents. So apparently, so sometimes the baby might not attach to the bottle in the same way that they normally attach or they suck a nipple. So this I found quite interesting.
Yeah. So there's a few things. So one of the biggest risk factors of bottle feeding is that it's very easy to overfeed your baby. And that's basically because the bottle just flows really easily. Babies love to suck for comfort. That's one of the things that they like to do. It regulates them, it calms them, all this kind of stuff. So on the breast, they can very much regulate the flow of milk that they get when they are comfort sucking. They're not taking very much milk, but on the bottle it's a little bit more difficult. So we have to kind of actively try and slow the flow down a little bit for them in order to not risk, this kind of overfeeding. The main problems with overfeeding is one is obesity, obviously, which too much milk. But one of the other things is actually reflux. So a lot of babies that are bottle fed, they're more prone to reflux, and it's basically because they're taking larger volume of milk, bigger than what their stomach really can cope with. So one of the first things is to make sure you use the slowest flow teats that you can. So make sure that whatever brands you're using, that you pick the slowest one. Sometimes it's marketed as a premature baby teat, actually. Even the newborn one is actually very fast, so it depends which brands you're using, but it's worth whatever the slowest option is. That's the best one to start with usually. The shape of the bottle can have a bit of an influence. So sometimes the sort of gentle sloping ones are often a really good one to try. The sort of medium-sized base ones are usually quite good as well. So, something along those lines. And you're right, sometimes a baby does prefer a particular shape. So it is worth experimenting a little bit and finding what works best for them. And then the actual acts of feeding, you want to do something that's called paced bottle feeding or responsive bottle feeding, or intuitive bottle feeding. There's all sorts of names for it, but it's the same thing, basically. So if you hold a bottle upside down with the teat pointing down, it just drips. They don't even have to suck to get the milk out. So that's why it is so easy to overfeed. They have their reflexes. So they have a sucking reflex, they have a swallowing reflex, they have a rooting reflex, which is around here, which is opening their mouth ready to feed. So often their reflexes are feeding when actually their stomach doesn't really need that much milk. So we have to be a bit careful around that. So we try and sit the baby nice and upright, and we try and encourage them to root. So we're offering the teat to them. We tickle the top lip with the tip of the teat. They open their mouth wide. We put the bottle up into the roof of the mouth to begin with. We actually give them a few sucks, especially if you're trying to stimulate with breastfeeding. You give a few sucks without milk. But even so, it's sometimes quite a good idea to just allow the baby to have a minute or two. They don't actually swallow air when there's no milk in the teat. This is a complete...
Oh, that's interesting.
Yeah, it's a total myth. It's just like when we're getting to the end of our drink. If you're drinking it with a straw, you're sort of that last bit, and it's making all the bubbly noises. Like
You're not then...
yeah. Sure. If that makes sense, it's the same kind of thing. Yeah. So, and then we tip the bottle and we try and keep it as horizontal as we can whilst still filling the tip of the teat. So the bit that actually goes into the baby's mouth, we try and keep that full. So the thing that it does cause wind, sometimes if you've got it kind of half full, they then will drink some air, so. And we give them a few sucks. Now, the babies will often chug it down. You'll be getting lots of sucks and swallows. Sometimes the babies will not stop and they just suck. So we can actually pause them a little bit, just again by tipping the milk back into the bottle and allowing them a few sucks without any milk in it. And often the baby will actually stop sucking and have a little rest.
Right, okay.
And then there's a period where the baby actually might stop and have a rest as well. And in that case, again, you want to tip the bottle back and allow them to have a break. Because if you leave it, even in a horizontal position, it will still drip into their mouth.
Yeah.
So you're sort of kind of slowing that flow down, and you just try and be responsive. We try and feed the babies when they want to be fed, so we're not trying to get them on a strict schedule. We don't need a certain amount of milliliters every feed. You'll get to know your baby and what they actually need. Some babies like to feed little and often. Some prefer a slightly larger volume less frequently. So it varies massively. Yeah.
And if you're combi feeding,
Yeah.
is there any pattern that you would want to follow there, or is it literally at whatever feed, whether you've got breast milk or formula available?
With express milk, you mean that we've gone filling it. So it's, I think it's time up to you. It would be nice for the baby to have some breast milk every day. I would suggest.
Rather than having formula days and breast milk.
That would be probably my suggestion. But other than that, not really. It's what's available and how much you want to do. But yeah, that's probably what I would say is try and, if you've got a set amount in the freezer or in the fridge, and you've got, it's going to be a certain amount of days until you get some more, space it out.
Yeah.
Basic.
To have a little bit every single day. Yeah, that makes sense.
And on that basis, we're talking just some of the logistics around that. So, because of the distance, and I know this has been the case for a lot of our UK IPs and surrogates who have been feeding, that there's postage involved. Talk to us about that. I'm just currently sourcing all of my equipment for posting my milk across the country. But yeah,
it's a tricky one, isn't it? It's to try and keep it fresh. So it needs to be chilled. Are you planning to freeze it? Yeah, that's the best thing to do. So we freeze it. Try and freeze it immediately. Within straight away really is a good idea. And when you are posting it, you'll need to pack it with probably some ice blocks, keeping it cold, well insulated box. And hopefully by the time it arrives, it should still, if you're squeezing the packet, it should still feel rusty. Yeah. So that's what we're ready for. If it's scrunchy, you can put it back in the freezer and it's absolutely fine to store it that way. Or obviously you can defrost some straight away and feed it as well. Sure. Once it's been defrosted, you have around 24 hours to use it once it's fully defrosted. So it's worth just thinking about your logistics. Better to defrost slowly overnight in the fridge if you can. If you have one of those days where you just get a little bit, we've forgotten to take the milk out, you can just stand it in some hot water and defrost it quickly like that, and it does work. It's fine. We don't ever microwave it, so don't microwave it. But you get hot spots and such like, so it's a bit escalating. But yeah, you can deposit quickly if you need to, but it's better to be, planning. So if you're using some and you're going to use them next day, take it out the night before if you can, and leave it like that.
Okay.
Well, I want to say a big thank you, particularly to you, Catherine, for your expertise in this area and for guiding us all through it. Thank you for being here in the studio with us today. And to Danny and Edu for just sharing your expectations for your journey as well with your baby. If this episode touched you and you'd like to find out more about my surrogacy journey and our completely unique surrogate membership, please head over to our website, www.mysurrogacyjourney.com, or follow us online on Instagram at official My Surrogacy Journey. If you love this episode, then please subscribe to the series because we're going to have episodes coming out weekly. We can't wait for you to tune in and follow us. Thanks for listening.